Good afternoon, bon après-midi. Thank you for joining us for today's media availability on the novel coronavirus COVID-19. Merci de vous joindre à nous pour cette disponibilité média au sujet du nouveau coronavirus COVID-19. Before we begin, I'd like to go over a few items. A reminder to please place your microphone on mute until I invite you to speak or to ask your question. To view the city official who is speaking on Zoom, please put your view on speaker view instead of gallery. The button for this is located in the top right corner of the Zoom video screen. Veuillez changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de la portion vidéo de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today, we will be hearing remarks from Councillor Keith Eglai, Chair of Ottawa's Board of Health, Président du Conseil de santé d'Ottawa, and Dr. Vera Etches, Chief Medical Officer of Health, Médecin-chef en santé publique. Also on the line to respond to questions, we have Mayor Jim Watson and Paramedic Chief Peter Kelly. Aussi sur la ligne, nous avons le maire de la ville d'Ottawa, Jim Watson, et le chef des services paramédics, Peter Kelly. After the remarks from the chair and Dr. Etches, we'll then take questions from media. Please go ahead, Chair Eglai.
Thank you, and bonjour, Quay, good afternoon. I want to begin today by expressing our sincere appreciation to the Government of Ontario for its consideration and quick action in amending the current emergency orders to permit the use of outdoor allotment gardens and community gardens across the province. These gardens are a vital source of nutritious and affordable food for our communities, and we are pleased to hear that they will be able to operate while still adhering to important physical distancing guidelines. Ottawa Public Health is currently collaborating with municipal and community partners to develop guidelines and recommendations for the best practices when using community gardens in Ottawa. Together, they will determine garden-specific strategies that will be shared with residents once finalized. Again, I want to thank the Government for Ontario for the action in hearing from the Board of Health, hearing what the residents of Ottawa were very interested in, and I look forward to seeing these gardens bloom in the very near future.
Thank you, Chair. I now invite Dr. Etches to speak.
Okay, thank you. Also, bonjour tout le monde. Today, the Ontario Premier unveiled the province's framework for gradually reopening the economy. And we will be reviewing this framework with our municipal and our healthcare partners to provide more information about what this means for Ottawa and people in Ottawa in the coming days. Aujourd'hui, le Premier ministre de l'Ontario a dévoilé le cadre de la province pour la réouverture progressive de l'économie. Nous examinerons ce cadre avec nos partenaires municipaux et du système de la santé et fournirons dans les prochains jours de plus amples informations sur ce que cela signifie pour Ottawa. At first glance, the plan does appear to consider the same kinds of things that we would expect to be considered in reopening the economy safely. This past weekend, surveillance testing began in long-term care homes in Ottawa, and this exercise was completed as part of the provincial direction that was announced last week to test all residents and healthcare workers in long-term care homes. So the paramedic service, the Ottawa Paramedic Service, deserves a big thank you. We could not have accomplished this task of testing over 1,700 residents and healthcare workers in 9 long-term care homes facing the most challenge this weekend without 26 Ottawa paramedics who joined in the work, who were willing and trained and capable to go and take swabs so that tests could be processed. I also want to thank our partners from the Champlain Health Incident Command and the Eastern Ontario Regional Laboratory Association for their efforts this weekend. They're working alongside Ottawa Public Health team members who also have my thanks for continuing their strenuous efforts to control COVID-19 in our community. Comme pour le service de paramédics d'Ottawa, je tiens également à remercier nos partenaires du commandement des incidents de la région sanitaire de Champlain et l'Association des laboratoires régionaux de l'Est de l'Ontario pour leur effort cette fin de semaine. Ils ont travaillé aux côtés des membres de l'équipe de santé publique Ottawa qui ont également mes remerciements pour leur effort acharné pour contrôler la COVID-19 dans notre communauté. This kind of collaboration with city, healthcare, and public health workers makes me really proud of this response in our area, and it is the way we'll continue to work with an ongoing focus on long-term care homes. Ce genre de collaboration avec la ville, les professionnels de la santé et santé publique me rend fière de la réponse dans notre région. Et c'est de cette façon que nous allons continuer à travailler alors que nous continuons à nous concentrer sur les soutiens pour les foyers de soins de longue durée. So we know that asymptomatic transmission occurs, and we expect an increase in the number of cases coming out of this surveillance exercise as a large number of healthcare workers and residents are tested. And this is to give us a better understanding of the current state of COVID-19 infections in long-term care homes. And while testing is important to provide a picture of what's happening at that one moment in time, infection prevention and control measures, including wearing a medical grade face mask at all times while working, and proper cohorting of people infected with COVID-19 continue to be the most effective ways to decrease COVID-19 in long-term care homes. Bien que le dépistage soit important pour fournir une image de ce qui se passe à un moment donné, les mesures de prévention et de contrôle des infections, y compris le port d'un masque facial médical en tout temps pendant le travail et le regroupement approprié en cohorte des personnes infectées par le COVID-19, du mieux les moyens les plus efficaces de freiner la propagation de COVID-19 dans les foyers de soins de longue durée. So lastly, I'll turn to the warmer weather, which we're very, very happy to see, and more people taking advantage of the outdoors for exercise, which is encouraged. Physical activity and getting fresh air are important for overall physical and mental wellness. And so I do advise everyone who can go outside to do so in a safe way. It's important to take care of our mental and physical health, and so our neighborhood walks are still open. For most people, it's safe to go for a walk, but there are important considerations about still being able to stay 2 meters away from others. C'est important de prendre soin de notre santé mentale et physique. Nos trottoirs, rues et sentiers polyvalents sont toujours accessibles pour sortir et bouger. Pour la plupart des gens, il n'y a pas de mal à sortir, se promener, courir ou faire du vélo, tant que vous pouvez continuer à pratiquer la distanciation physique. Others might need to stay in their homes for their own safety or the safety of the community. So this would be like people who have recently returned from outside of Canada. If you've come into close contact with someone who has tested positive for COVID-19, and also people who have symptoms of COVID-19, even if they're mild symptoms. Ottawa Public Health website has new information about staying safe while being physically active in our neighborhoods, as well as questions to consider before going outside. So visit our website to stay up to date and safe when doing these activities. Thank you to the entire community for the actions taken. These actions matter. I know we're planning ahead about being able to lift restrictions, but we still are asking you to continue to do what you have done really conscientiously. Stay home unless you're out for that daily physical activity or for essential reasons. And please do enjoy the warm weather in a safe way. Thank you. Merci. Miigwech.
Thank you, Dr. Etches. In the interest of time, I will quickly read through the list of media who have registered for today. No need to indicate if you're present. However, if I missed your outlet, please speak up after I am through the list. Pour gagner du temps, je vais lire la liste des médias qui se sont inscrits. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas nommé votre organisation. 104.7 Outaouais, Olivier Charbonneau. 1310 News, Chris Kurz. CBC Ottawa, Joanne Canello. CTV News Ottawa, Josh Pringle. Global News, Craig Lord. Le Droit, Julien Paquette. Ottawa Citizen, Andrew Duffy. Ottawa Sun, Taylor Blewett. Radio-Canada, Laurie Trudel. Rogers TV, Gavin Lumsted. And Your Community Voice, Patrick Guccione. Have I missed anyone? Wonderful. I will now invite each agency to speak in alphabetical order to ask their question. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. We'll now start with 104.7 Outaouais. Olivier? Bonjour Olivier, es-tu là? All right, we will skip to 1310 News, Chris Curtis.
Yes, hello. Just want to make sure you hear me okay.
We do. Thank you, Chris.
Perfect. So first question for Dr. Etches. I'm just looking at the breakdown for the long-term care facilities, and today Public Health announced 7 new deaths, but none of those were at Carlingview Manor, where the operators confirmed a bunch more on Saturday. Is there a longer turnaround from them being able to confirm that it's COVID related to when Ottawa Public Health can, or how does that work in that situation?
Thank you. Obviously, outcome we're sad to see with more deaths in long-term care homes. That's what everyone's working hard to prevent. It is possible that the homes are counting people who have died without a confirmed laboratory test for COVID-19. That may be that these are definitely still possibly COVID-19. They would be suspect COVID-19 cases, potentially if they have symptoms that could be compatible with COVID-19. So the death certificate is signed, giving a cause of death. We're looking at how to capture all of these situations in our reporting. Right now, the way Ottawa Public Health is reporting on deaths is due to the confirmed laboratory tests that are in our provincial database. So the provincial database, counts all the deaths associated with confirmed cases. If there are other deaths in homes, we do want to share that picture, and so we're looking at how to do that and collect that information, which the homes would have first. And there's no simple way to get that information from the death certificate. So we're looking into this.
Thank you. And I just have a follow-up for Mayor Jim Watson. Your thoughts on the provincial plan to reopen the economy, especially when you compare it to our eastern neighbors in Quebec who are planning to send younger children back to school in about 2 weeks. That's definitely going to affect a lot of people who work in and around here in Ottawa.
Yeah, there's no question. There's a lot of connectivity between the two sides of the river, for sure. I think the plan that the Premier laid out makes sense. It's plan based on principles in 3 stages. And as he and I have talked in the past, and I've talked to other ministers, I think the slow and cautious approach is the way to go. The last thing we need is to open up segments of the economy too quickly, and then a second wave of the virus hits us, and these people then have to get laid off again, and the stores and the shops and the offices have to close. So we're better to be prudent. I can't speak for the Quebec government and what information they have, but I think the approach that the provincial government of Ontario is wise and sound. And we are working, obviously, in collaboration with them, because one of the areas we'd love to see open sooner than later are parks, but we're not going to go and do that until the time is right. But if they allow us to do that at some time in the future, then we have to be prepared. So we have to work in tandem with their public servants and ours to make sure that when the decision is finally reached, we're ready to hit the ground and make sure these facilities are available for the public.
Thank you.
Thank you, Mayor. Thank you, Chris. Up next, we have Joanne Canelo, CBC Ottawa.
Hi, thanks very much. I guess this is for Dr. Etches. One of the criteria that the Premier was speaking about this morning, or the province was speaking about, was the idea of being able to do tracing within 24 hours, right? So I know you've talked about this before, having to ramp that up. How far away are we in Ottawa from being able to do that? I know it's very labor intensive, and sort of what are the plans around that right now?
Yeah, I read that too. I think it's a good criteria. I appreciate the work our team has been doing to identify contacts and follow up as fast as they can. That work will continue to be a priority into the future. I am sure that we're not reaching everyone within that first 24 hours, but I don't have the metric yet in hand. We will start to report on that as soon as we can. It is labor intensive. We have to talk to people who sometimes are quite ill, hospitalized, or sometimes we have to follow up with family members of people who are ill. So it takes sometimes a bit of time to get contact information and then reach contacts. But we, are looking at different ways to speed that up, including with technology. So we mentioned that at our Board of Health meeting. We're looking at a contact tracing app. Would probably be the first in the country to implement something like this. I do think that we need to use all the tools we have to be able to make that a quick process. And that metric, we'll be looking into how to capture that and report out on that. But Andrew, if we do, Andrew's online who's leading the response. I just asked him about this metric. If you think we have that number right now, Andrew, please jump in. I think that there isn't an automated way to calculate that yet. Anything you want to add, Andrew?
Yeah, I'm here, Vera. So I don't have that number in front of me, but that's something that we can absolutely get to the media and get to the public. Thanks.
Thanks, Joanne. And for your follow-up?
Yeah, great. So if you could just email that later, just, we're wondering how far we are from being able to do it in 24 hours, which does sound like a good idea, but I'm sure it's not easy. My follow-up though is about, again, with the provincial framework today. Toronto is different than Ottawa. Every city is different. We're different from Gatineau, for example. What is, this is for both Dr. Etches and Mayor Watson, is there a way, if we're at a different stage ourselves in Ottawa than we are in Toronto, can we open up very slowly before another city? Are we going to wait to be sort of roll out the same strategy right across the province? I'm just wondering about your thoughts on that.
Doctor, go ahead.
Yes, so I don't think we have enough clarity on that yet. I think we need to talk to the province about whether the metrics they'll be looking to are province-wide or there's more flexibility to go city by city. It is the case that sometimes there's a big difference between a rural area and an urban center. So I think this is something we need to talk further about and think about the best way forward. We're very interconnected as a province, as a country. We've heard the Prime Minister also speaking about the need to think about how our actions affect each other across provinces. So we certainly, we'll be measuring the local situations so that we can tell people in Ottawa how we're doing with all of those criteria for moving ahead safely. And then working with the province, if it looks like we can go further.
I think, Joanne, maybe I agree with what Dr. Etches just said. The challenge we have, of course, is we don't want to have a series of piecemeal rules and regulations in the province. We heard, for instance, last week, because the cases were relatively low in Kingston, one of their members of council wanted to start opening things up a little sooner. We saw that during the debate with the Smoke-Free Ontario Act, where in Ashton, it's banned smoking across the street, and Beckwith Township, they allow smoking. So I think we need some consistency in the province. I think the challenge we have, of course, is that there are some areas that are harder hit than others. And ultimately, that's going to be a decision by the province. They closed all the parks, for instance, as an example. They didn't, they're not going to open up parks in one particular neighborhood because their number of cases are down. The other challenge you have in a case like Kingston, if you decide, well, let's loosen up some of the regulations, all of a sudden people start getting invited back to go to Kingston and shop and so on, and are they bringing the virus into that community? So my hope is that it's a province-wide regulation, that it's consistent, and it's not a piecemeal approach based on where you live. The challenge is, of course, we're a border community, and the kids going back to school, I think May 11th in Quebec. We're not going to send kids back to school until at least after May 31st. So we're going to have a bit of a mixed bag of policies just in our own city, but that's the division of the two provinces, and we have to adhere to the province of Ontario's regulations.
What are but Mayor, what are the challenges for like the schools going back at different times?
Well, not a whole lot, unless you're a teacher that lives in Ottawa and you teach in Gatineau. Their school system is entirely independent of our school system, so there's no interdependence. There's no cross-border. Someone's not living in Ottawa going to school in Gatineau, an elementary school. That doesn't happen. It's not like universities where people cross the border. So I don't think, from the school point of view, there's any concern from our point of view, because all those kids will be going into schools on the Gatineau and the Quebec side, not on Ottawa side. I think, they're going to have to deal with the border issue where they have those stops. If people, live in Ottawa and work in the Quebec school board system, how they get across free and unfettered access to get to their job, they'll have to deal with the Quebec government, the Gatineau government on that point.
Thank you very much.
Thank you. Up next, it is Josh Pringle with CTV News. Go ahead, Josh.
Thank you very much. In the Ontario government's guidelines today, they said a consistent 2 to 4 week decrease in the number of new daily COVID-19 cases before they start the first phase, the second phase, the third phase. Do you know if we're on the decrease yet to get to the first phase of easing these restrictions, Dr. Etches?
This is where it's a bit challenging. That metric is dependent on testing continuing, and we are promoting testing. There's no question. The testing that we're doing right now is picking up a lot of cases in long-term care homes and retirement homes, which is important. Doesn't necessarily reflect all the infection in the community as much. So I think the province has suggested this is like there's two curves. There's the curve of the infection in the community, and then there's the curve of what's happening in congregate care settings. And so it's hard to answer that question because we're still seeing, unfortunately, the numbers go up overall and up in both places. So what's happened on the hospitalization side, which is another way of looking at cases in the community, is that they've stabilized. The number of people in ICU has been declining. So that I think the picture we have is that infection in the community is declining. So that is good. That's encouraging. It's just that we know in some parts of our community it's not declining, and that's a concern.
And my follow-up question is probably for the mayor. The premier today said that we won't see concerts or fans at sporting events for the foreseeable future. What's your advice to festivals? Everyone's sort of looking at Blues Fest right now. What's your advice to these festivals that are looking ahead now to the summer, wondering if they should go ahead? And also any idea what the city and the NCC are going to do with all the tulips that are about to start popping up along the canal?
Yeah, I wish I had a good answer for that very good question. There are a lot of, the bulk of our major festivals are taking place in the summer months. And obviously they're on pins and needles right now as to whether they should go ahead with those concerts and festivals or not. We made a decision to go as far as June 30th of not issuing any permits. We regret having to make that decision, but it was the right decision for health reasons and obviously other reasons. We will be meeting with public health over the course of probably in the next 3 weeks or so to discuss options available. But ultimately, the province will have the final say. This is it's a gut-wrenching time for those people in the festival industry because they put their heart and soul and lots of funds into making Ottawa a very exciting place in the summer. We've already seen the cancellation of the Tulip Festival, the Jazz Festival, and Canada Day. So I don't have an answer for you right now. We'll have to examine it closer to the time and give them as much notice as possible. With respect to the tulips, I did have a discussion with the NCC last week. Obviously, it is a challenge. The tulips are like a magnet. They draw a lot of people to Dow's Lake and Commissioners Park. And there was a special tulip bulb design for the 75th anniversary of the commemoration of the liberation of the Netherlands by mostly Canadian troops. So it's going to be a very special year. They're going to have a couple of things. First of all, the Tulip Festival is going to be doing some virtual programming of photos and filming and so on of the tulips. Secondly, the NCC will announce their own plans, but I suspect there'll be some kind of coordination that if you're going to allow people to come into the park, it's going to have to be like you see in going into the grocery store. So many people at a time, and cordoned off so people can go in and enjoy and take pictures, but keep moving on. And we'll have to look at seeing what kind of parking restrictions that would be put in place that you normally see during the Tulip Festival, as well as Winterlude, because quite frankly, there will be no infrastructure except the tulips there. There'll be no porta potties and washroom facilities, no food kiosks and so on. So ultimately, it's the NCC's park and their tulip beds, and they're going to have to come up with some program in collaboration with us and public health to make sure that if those people, if we are able to allow some people to go in and look at the beautiful tulips, it's done in a safe and physical distancing fashion.
Thank you, Mr. Mayor. Thank you, Josh. Up next, we have Craig Lord with Global News.
Yeah, this is actually a good follow-up to what Josh was asking about. I think it would be for the mayor, and it's a question about farmers markets this summer and whether we might be able to see them pop up in some form with some kind of physical distancing measures in place. Has there been any talks about that at the city level so far?
Yes, yeah, my office has been involved in that for the last couple of weeks because we're coming up to farmers market season, and we have some pretty amazing markets, whether it's in Westboro or at Lansdowne or in Cumberland and all over the city. We're working with the Farmers Market Organization and city staff, as well as public health, to come up with a plan that will allow us to open the farmers market, for instance, at Lansdowne. But again, there'll have to be some kind of cordoning off and only permit so many people into the vicinity at one time, and to practice physical distancing. So we very much want to see the market go ahead. These farmers have put a lot of time, effort, and money into planting their fields in the fall, and obviously this is their base income. So the farmers markets will open. The exact date we're still working on, number one, and making sure that we protect both the customers and the vendors and the farmers is of paramount importance. More challenging in an area, for instance, the Westboro Farmers Market is very narrow. It's on the Byron Linear Park. So we'll have to use, the advice of Dr. Etches and her team as to how we roll these out in a safe fashion, but that allow the farmers to come and sell their goods and their fruits and vegetables. So it's something, as I said, my office, I have one person assigned to the office has been working on this with the farmers market president and their organization, as well as city staff at Lansdowne. As you know, farmers market on private property can go ahead as well, as long as they respect physical distancing. I think of the carp market, it's not on public land like Lansdowne, it's private land, so it can go ahead, but it will still have to respect the physical distancing as well.
Great, and just a quick follow-up. Has there been any talk about putting elements of the farmers markets virtual, bringing some e-commerce to kind of replace and maybe offset the physical congregation that happens at those markets?
I know there's been some discussion on curbside service, that you put an order in and it's delivered, curbside, so you don't have to go in and walk in within either the Aberdeen Pavilion or outside in Aberdeen Square. But I'm not aware of any other specifics at this point, but it's certainly something that farmers, I know some farmers are actually doing that on their own property before the market season started. So, we very much want the markets to open and thrive and do well, because it's also a great opportunity from a health perspective to get some healthy local produce and other goods, whether it's baked goods or honey and so on, and maple syrup. So if we can accommodate that and help them use technology, then we're obviously open to that as well.
Great, thank you.
Up next, we have Julienne Paquette with Le Droit. Julienne, à vous.
Merci. Dr. Etchez, la situation dans les foyers de soins de longue durée, d'un côté, j'imagine que ça doit vous réjouir de voir qu'on a cessé, qu'on a pu arrêter freiner le nombre de décès dans une résidence comme celle de Montfort. Mais en même temps qu'on voit le nombre augmenter à Madonna Care. Donc, qu'est-ce que vous pouvez me dire un peu sur l'efficacité des mesures qui sont mises en place pour freiner la propagation dans ces résidences-là?
Oui, encore, je suis désolée pour les familles qui ont perdu leurs membres de leur famille. Et je peux dire que la situation actuelle au courant reflète des actions 2 semaines auparavant parce que ça prend temps d'être infecté et d'avoir un mauvais résultat comme les morts. Mais aujourd'hui, nous avons beaucoup de travail avec toutes les maisons de soins de longue durée. Et je peux demander à Andrew Hendricks peut-être d'expliquer plus que sont les activités de beaucoup de partenaires.
Oui, merci Vera. Je peux ajouter qu'est-ce que Vera a dit, que toutes les institutions sont des priorités pour Santé publique Ottawa, ainsi que nos partenaires. C'est une des raisons pourquoi nous avons travaillé avec nos partenaires, ainsi que le service paramédic d'Ottawa pour compléter les tests de surveillance dans les centres de soins longue durée durant la fin de semaine, incluant les institutions dont vous avez mentionné. La chose d'important de réaliser, puis je pense que Dr. Etchez avait mentionné ça dans au début, c'est que les dépistages, c'est vraiment juste une image dans le temps. C'est vrai que quand vous dites que les décès, c'est une autre mesure, que malheureusement, c'est toujours triste de voir les décès augmenter. C'est vraiment les démarches qu'on prend avec nos partenaires pour prévenir d'autres infections dans la communauté. Fait que de faire sûr que les personnes portent des masques quand ils sont dans les institutions, ainsi que laver les mains, bien laver les mains, de faire sûr que s'il y a des cas, qu'ils restent en isolation. Fait que ça, c'est toutes des priorités pour nous et pour nos partenaires de le système de santé. Et on va continuer de travailler avec eux et avec toutes les institutions qui ont des éclosions puis des cas.
Merci. Before I ask my follow-up, I just wanted to know, Mr. Kelly, can you speak French or not?
I cannot, Julie.
Okay, perfect.
Yeah.
I'll ask in English then.
Thank you.
I was just curious, since you deployed so many resources for the testing this weekend, how did you manage to deploy these resources for the testing while assuring a level of service that's sufficient for your main body of work, basically?
Of course, Julian. Yeah. So we normally have 8 community paramedics that are deployed across the city. So we supplemented them with what we'd say from our regular operations, and that was with mainly with staff that were off schedule.
Thank you very much.
You're welcome.
Okay, merci. Now we have Andrew Duffy with the Ottawa Citizen. Go ahead, Andrew.
Thank you. Dr. Etchez, you talked about the 2 curves, the one in the community and the one in congregate care.
Sorry, Andrew, could I ask you to speak up, please? It's difficult to hear you.
Yeah, sorry. In terms of those 2 curves, do you think that the province should only be looking at the community curve in assessing whether or not to reopen the economy? Sorry, can you hear me?
Yes, I can. Sorry, I had to unmute as usual. What I've heard the Premier and the Minister of Health say is that they're concerned about infections in long-term care homes as well as other congregate settings. So they are watching both of those curves as well. So I think when they made a list of the criteria for easing up restrictions, one of them is about the health system capacity. And so that would include what's happening in long-term care homes and other settings. You need to have that under control. We need to have the capacity, for hospitals who are currently right now helping staff long-term care homes to be able to have the staff they need. So I would capture that as part of the overall picture that is being considered. I am sure that the province is considering not only the decline of cases in the community, but the whole picture.
And Mr. Mayor, as the provinces discuss reopening, has there been any discussion as yet as to when the bridge will be unfettered between our provinces?
It was very faint, Andrew, but I think you're asking about the checkpoint at the Gatineau side of the bridge.
Yeah, I'm just wondering if there's any discussion yet as to when that might be removed.
No, I haven't heard anything from Mayor Maxime Penneau-Jobin. As you know, there was some thought that we would replicate what was going on, and I didn't support that, neither did our chief of police. We thought it would be not a good use of scarce police resources to have 50 to 70 police officers covering 70 or 5 bridges for hours at a time. So we haven't heard at this point. I know it's been an inconvenience for some people, and a number of people have been turned back and so on. But I don't think it's something that we would entertain. And I spoke to both Minister McLeod and the Premier about our desire not to replicate that, and they've so far backed us on that.
Thanks very much.
Thank you.
Great, thank you.
Just as a side, I think we're probably fortunate, the fear of traffic jams and backups and so on, because there's so little traffic, it hasn't been a problem. But as more and more businesses open, as we hope they will in the weeks ahead, that may cause greater angst and frustration for motorists trying to get to and from Gatineau and Ottawa.
Thank you. Next question is from Taylor Blewett with the Ottawa Sun.
Hi. So it's actually very similar to Andrew's question. For Ottawa Gatineau, we're obviously so interconnected, and as both provinces continue moving forward with easing of restrictions, reopening some businesses, is there work going on between both cities to make sure that there's kind of special coordination for what's happening here, both obviously travel across the bridges, but kind of making sure that we're in a similar place with what people are allowed to access or not?
I can take that as well, Mayor. I don't know if you want to speak first.
Okay. No, go ahead.
So in both provinces, much of their decision making is going to be based on public health surveillance information. So what's happening with cases, what's happening with outbreaks. And we know the specifics may be different, for instance, opening elementary school in Quebec or not in Ontario, but the metrics they're following and the public health advice about the risk to the population should be very much considered collectively. And so Ottawa Public Health is working with our public health colleagues in Gatineau to be able to share that information routinely. We have regularly scheduled meetings where we talk about the epidemiology, we talk about what's available. I think that this is important going forward. We'll want to be looking at both of those metrics together to get the picture of the National Capital Region entirely. And so we'll continue to do that.
I think, as you pointed out, that the economies are interconnected. Our transportation systems are interconnected with STO and OC Transpo going across the borders hundreds of times each day. We keep in close contact with Gatineau and with the mayor's office. At this point, the decisions they've made in Quebec really are Quebec focused, opening their schools and so on. It won't have any impact on our system, whether it be transit or the road network and so on. So while we're connected, a lot of the services that they have announced they're going to go ahead and open up, or such as the elementary school system, won't have an impact on the city of Ottawa.
And for my follow-up, it was quite a while ago now that June 30th was set as the date for city facilities and services to remain closed until. I'm wondering, is there a chance that date could be adjusted, providing that public health indicators suggest maybe it could be safer for things to resume early, and if that's in line with the provincial plan, or is that pretty firm at this point?
Maybe I'll start, Dr. Etches, and then you can offer a comment from the medical perspective. No, the date is firm. We've set that date. We're not issuing permits. The major festivals have already announced that they're having to cancel, including July 1st, the day after, and Tulip and others. And, we've lost, obviously, a lot of major convention business as well in the month of June. So that date is firm. What we're tasked with now is coming up with a new date in collaboration with health and with the province of Ontario if we're not satisfied that it's not safe to do so, or it's safe to do so. So we're in a situation where it's very fluid. We just don't have the answer. I think, as the Premier said in his press conference, he wishes he had a crystal ball. I think we all do, so that we could give more certainty and assurance to organizers of these major events and sporting events and so on. We have seasons coming up. We don't know what's happening to the NHL, the CFL. We've got soccer and baseball and all sorts of other things, including little leagues that people are eager to get involved with and would normally have been started by this time of the year. But we're not going to take any risks, and that's why, unfortunately, we've had to make that decision of a date of June 30th, and we will review that number. It's not going to move forward. If anything, it will move farther into the summer, unfortunately, if we haven't seen significant progress on our battle against COVID-19.
Yes, I would agree with the mayor that there is very unlikely that even given if you would just follow the best possible scenario for timelines under the provincial plan announced today, I don't see the date of June 30th moving forward. We need to move slowly and assess. It says for 2 to 4 weeks, the initial stage 1 of the reintroduction of some activities. So you need that time to monitor the impact on the infection in the community. I believe their initial stage 1 activities include opening some outdoor spaces like parks and allowing for a greater number of individuals to attend some events such as funerals. And so there are a lot of questions about other types of events, what would fit into that. And so I think this is just the beginning of the discussion. The province also, in their launch of this plan today, indicated they'll be consulting with many partners, municipal, parents, all kinds of folks, just like we want to do here. And so, I think that we'll get more clarity over time.
Thanks so much.
Great, thank you. Laurie Trudel avec Radio-Canada. À vous.
Oui, bonjour. Ma première question est pour le maire Watson, pour mon collègue Gilles Taillon, que vous connaissez bien. En fait, donc c'est moi qui vais poser la question en français aujourd'hui. Monsieur Watson, vous l'avez dit un peu là, en anglais tout à l'heure, mais si c'est possible pour vous de réexpliquer, mais en français, comment vous voyez ça, le plan de déconfinement, le plan de réouverture de l'économie du gouvernement Ford qui a été annoncé aujourd'hui, et quel genre d'impact ça va avoir dans notre région à nous qui est frontalière avec l'Outaouais, où la situation peut être assez particulière. On parlait des barrages routiers et tout ça. Donc, comment est-ce que vous voyez ça, le fait qu'on soit dans 2 provinces, mais 2 villes collées une sur l'autre?
Oui, sur la première question, le plan de M. Ford, il n'y a pas beaucoup de détails spécifiques. C'est un plan des principes pour ouvrir plus de l'économie dans la province de l'Ontario. Et j'appuie ce processus. Je pense que c'est vraiment important de suivre des suggestions des médecins et des bureaux de santé publique. Et ça, c'est la raison, par exemple, que on ferme des parcs et des restaurants, des choses comme ça. Au sujet de Gatineau, certainement, nous sommes une région économique. On travaille très bien avec Maxime Pedneau-Jourdain et la ville de Gatineau. Et certainement, on avait le transport en commun, travaille ensemble, STO et aussi Transpo. La province de Québec a décidé leur priorité et il a décidé d'ouvrir les écoles dans la province de Québec. Et il n'y a pas vraiment un effet pour les résidents ou les gouvernements de ce côté de la rivière. C'est vraiment une décision de la province. Il n'y a pas vraiment un effet sur nos activités ici.
Mais pour les barrages routiers, vous disiez que ça pourrait quand même créer certains problèmes?
Oui. Comme j'ai dit, quand la province a décidé de faire ça, beaucoup de monde posait la même question à moi. Est-ce que la ville va suivre ça? Et j'ai dit non. Et c'est la même réponse de notre chef de police, Peter Slowly. Je ne pense pas que ça, c'est une bonne idée, mais c'est la responsabilité de la ville de Gatineau. Maintenant, ce n'est pas vraiment un grand problème parce qu'il n'y a pas beaucoup de circulation parce que la plupart de la population reste chez eux. Alors, j'espère que à un moment, la ville de Gatineau et la province va décider d'arrêter ce processus, mais il avait le droit de faire ça. Mais la ville d'Ottawa ne suit pas cette barricade dans notre frontière, à cette côté de la rivière.
Parfait, merci. Ma deuxième question est pour le Dr. Etches. Concernant les problématiques dans les centres de soins de longue durée, vous avez dit tout à l'heure en anglais que ça prend 2 semaines avant de voir les résultats vraiment concrètement sur le terrain dans ces maisons de soins de longue durée. Par rapport à l'augmentation du nombre de tests qui sont effectués, surtout dans ces maisons-là, est-ce que vous avez l'impression que justement dans 1 ou 2 semaines, on va voir les résultats et quel genre de résultats vous vous attendez dans 2 semaines dans ces centres de soins de longue durée avec toutes les mesures là, supplémentaires que vous avez mis en place?
J'espère dans 2 semaines, on peut voir que les nouvelles infections sont arrêtées, sont terminées. On veut voir aussi que le nombre de personnes mortes est aussi arrêté. C'est un peu plus difficile avec le résultat d'être mort parce que ça aussi peut prendre plus que 2 semaines. Si quelqu'un va à l'hôpital et on essaie les traitements et ce n'est pas efficace. Mais oui, bien sûr, on veut voir que les normes d'infection n'a pas arrêté après les mesures en place aujourd'hui.
Par rapport à l'augmentation du nombre de dépistages, à quoi vous vous attendez?
Je pense, j'invite Andrew de répondre plus, mais je n'attends de rien. Les mesures importantes sont importantes s'il y a un dépistage ou 20 dépistages ou 40 dépistages, les mesures sont les mêmes. On n'attend pas pour un résultat. Il faut utiliser les masques maintenant, il faut faire les mesures de protéger les résidents, de garder les gens infectés dans les différents espaces que les gens non infectés. C'est vraiment des mesures comme ça qui ne sont pas dépendantes d'un dépistage. Mais on peut voir, j'imagine, avec le grand nombre de dépistages que nous avons fait, qu'on va voir plus de cas. Parce qu'il y a des gens qui n'ont pas de symptômes, qui sont infectés. Mais on veut que le nombre des infections nouveaux arrête. Andrew, si vous voulez ajouter quelque chose.
Merci, merci Vera. J'étais pour juste ajouter le point que vous avez mentionné à propos des personnes qui n'ont pas de symptômes, que le résultat peut venir, le résultat du dépistage peut venir positif. Fait que ça, c'est, on attend que quand tu fais des grands nombres de dépistages, qu'il va peut-être avoir une augmentation de cas. Mais à long terme, nous voulons voir plus de cas, puis plus de décès dans les institutions. C'est vraiment l'objectif de tous les supports qu'on met avec nos partenaires dans les institutions.
D'accord, merci.
Merci. Alors maintenant, c'est Your Community Voice. Patrick Aguccioni, please go ahead.
Yeah, my question is for Dr. Etches. My questions have kind of been asked already, but I'll try to ask it in a different way. We heard a lot about the province isn't going to relax the rules for at least the next little while, and when they do, it'll be relaxed a little bit at a time. But is it fair to ask you to speculate what types of businesses you would think would reopen first, or can you see schools opening now before September? Sorry to ask you to sort of look into a crystal ball, but.
Yes, so on the first part of your question about what types of workplaces first, it's going to be risk-based in terms of can the workplaces demonstrate that they're able to avoid transmission of COVID-19 in the workplace. For some types of work like landscaping, where someone's outside on their own, not interacting with anybody, they're probably avoiding transmission of the infection most of the time without having to change very much. But we want to work with different workplaces so that we can mitigate that risk. So if there are other workplaces where a lot of people work in very close quarters, that's going to be a higher risk. And so those types of workplaces may not be permitted to open first unless we can find ways for them to do that where those people that gather don't have to be in such close contact. So I think in general, these would be the principles that we'd be looking to follow across the province. The province will provide more clarity. This is the beginning of the discussion, I think, about which workplaces when. But I think you see some of that concept reflected in their document. When it comes to schools, and I don't feel comfortable making a prediction about September. I think this is a step-by-step process. We're in completely new territory. We need to monitor what's happening and learn at each step of the way. We will learn if Quebec is going ahead. We will learn from what they're doing. From other parts of the world, we are monitoring and learning. So it's just too early for me to make a definitive answer about that for September or before. I don't know.
And in my follow-up is the numbers that were released today says there's 212 healthcare workers and first responders that were tested positive. We get memos, say, on OC Transpo and long-term care centers and child care centers, but I don't think we've ever heard how many are, say, in the police service or paramedics, unless I've missed it. Maybe Peter can speak to that, or Dr. Etchen.
I can speak to the memo piece in regards to as soon as we have a case. So I can tell you we've had 3 paramedics tested positive for COVID-19. So as soon as we're notified by public health and the contact tracing piece starts up, if you think from a paramedic perspective, they're doing basically most of their calls in full protective apparel. So for the contact tracing, there's no exposure to to patients or residents. So really the contact tracing is with other employees that they may have engaged with during a certain period of time. So we do put out an internal memo to all staff in regards to that, and normally the contact tracing is very narrow, that there's no notification out to public. Public health does their notice one-on-one with any public contacts. And very certainly Dr. Etches can add on to that.
Yes, the priority is informing people who need to take some action when there's a case and close contact. So for most workplaces, we're able to do that one-on-one, just as the chief said. So our process is to work with the workplace, whether it's police, paramedics, others, private institutions. The work of informing the public, if there was a need, we would do that. If it was something that involved a lot of members of the public being served by somebody who was infectious and exposing members of the public, we would release that information if it was necessary. But we just haven't had to do that so far in these situations. Not sure if that answers your question, Patrick.
Yeah, no, that's good. Thank you.
That's great. Thank you all. That's all the time we have for today. C'est tout le temps dont nous disposons aujourd'hui. Thank you for joining us. Merci.